because if we're sitting here looking at this childbirth trauma inquiry without looking at what we can do ourselves to change our birth experiences, then I don't think we're going down the right path. What Syntocinon can do is just pelt your uterus over and over again with these very strong, unnatural, long contractions, causing hyperstimulation of the uterus. But she wasn't told that. And she wasn't told there were options, like she could leave it. And hey, maybe we can compromise and maybe I can come in regularly for monitoring to see how the baby's doing. That wasn't an option. Instead, she was coerced with very emotive language. Risk of stillbirth. Evening, everyone. I hope you've all had a wonderful day. I didn't plan on doing a live today, but I felt an impromptu live was necessary after today's news. Hi, Mel. Okay, so I want to make something clear before I carry on. My approach is usually not to criticise, instead create. And I'm still going to hold true to that. But I also feel it's really important to deduce and understand that there's a huge problem in maternity care, and that's the lack of informed consent. And you can't make an informed decision without information. So today, this evening, I really felt to come on here to talk about all the news that I'm sure everyone's been witnessing today. And it's I'm just going to read a little quote from the BBC. Poor maternity tolerated as normal, inquiry says. Well, yeah. And I don't know about any birth workers watching this. I've heard thousands of women who have described their birth experience, their trauma. They've come away thinking it's normal, but it's not. It's common, and there's a big difference. So it says here, the birth trauma inquiry heard harrowing evidence from more than 1,300 women. Some said they were left in blood-soaked sheets, while others said their children had suffered life-changing injuries due to medical negligence. I don't need to explain how horrific that is, but I do need to explain something. We can't change the system, but we can change ourselves, and we can do better. Now, the problem is, you don't know what you don't know. And women enter the maternity system happy, healthy, excited, but they often leave downtrodden and traumatized, and worse, are gaslighted into thinking that their body has failed them. And then they think, oh, that's normal. And then we hear all of this trauma amongst women. This was my birth experience. This was my birth experience. All awful, awful, awful. So it wouldn't be unreasonable to expect women to assume that that's normal. But it's not. It's common. I have been through it myself. I was 21. I felt abused. But I also, get this, and I'm not alone here, I also had some sort of bizarre twist of Stockholm syndrome, because I thanked the people who sabotaged my birth because they saved me. This is a common theme in abusive relationships, is it not? You stay with the person that makes you feel safe because they make you feel that bad too, but then they can bring you up and you kind of excuse it. Now, disclaimer, I am really not having a go at the well-meaning individuals, midwives, in the system, because unfortunately right now they are a product of the beast. It's a pyramid. It's not based on evidence, maternity care, or very little. And even if you look at evidence, where were the studies taking place? Because if we're trying to understand physiological birth, can we understand it by observing how women give birth under bright lights and strangers and BP machines? Can we understand physiological birth like that? And more to the point, we as humans, we bloody love the mind, you know, and it's great. I'm not dismissing that. We've got so much knowledge. We've got this metacognition. It's amazing. But what about here? Because intelligence without wisdom is really dangerous. And what I can see from this report, we love a blame, right? And I'm not excusing this. This is fucking horrific, right? But we hand things over to other people. I'm sure if you're a follower of mine, you are more inclined to take responsibility for your own health and for your own pregnancy and for your own birth, which is awesome. But that's what we need more of. We can't keep criticizing a system that isn't fit for purpose. It works really well, actually. Maybe not for the women birthing inside it, but as a conveyor belt machine, it works really well. So for those of you watching, you don't know who I am, my name's Nikita Stark, and I'm founder of When Push Comes to Shove, which is a decentralized maternity structure. I never set out to create it, it kind of just happened. What is a decentralized maternity structure? We're not governed by any NMC, GMC, because we don't practice any clinical care, but we have birth keepers, advocates, doulas in 10 countries. And we help women to either navigate the system, have a toe in the system, or birth completely outside it. And everything that comes with it. Social services, referrals for free births, helping women ask the right questions for big babies or overdue. So what I would like to tell you now is a story. And I want to tell you a story on the back of today, because if you're watching this and you know this story, because this might be you or your sister or your mum or your friend. And if you're a bloke watching this, keep watching this, because birth affects every single one of us. We've all been born. So I'm going to tell you Emma's story, and I've disguised her name because she doesn't know I'm talking about her. And Emma's story is too common. And I'm just going to make a few points on the way through her story, because if we're sitting here looking at this childbirth trauma inquiry without looking at what we can do ourselves to change our birth experiences, then I don't think we're going down the right path. If we keep trying to cut weeds and look at external stuff, oh, we've got to fix the policies here, got to change the NICE guidelines here, that's not going to work, not in a macro view. And here's why. Because if we change one thing, we've got to change another. But if we change our roots, we will see different fruits. And the very things we try to defend against and criticize, we're able to advocate for ourselves more, or those problems aren't there. It has to come from an entirety of mind, body and soul, not just looking at the external things. I've got to change this, got to change this, got to go here. This is really important. Now, I also want to say a disclaimer. Don't believe a word I say. Don't need to. Might not know who I am. My word will mean nothing. I don't have letters behind my name. So you might want to just stop this live now, because it won't be important to you. But if you do want to still watch and you have an interest in my experience as a holistic birth keeper of 15 years and a very experienced advocate, just please listen to this story and send this to people who you might think this will help. In fact, send this to every woman you know, because it's important. But do your own research. Go to my website, whenpushcomestoshelf.co.uk. We have a plethora of information. Go to my Substack. I have mountains of blogs. If you liked evidence-based information, check it out. If you want to hear my experience, get in contact with me. But don't believe a word I say. Again, this has to come from within. We need to stop looking outside of ourselves to make things better. We have to go within. I'm just sharing with you my experience and Emma's experience. Okay, so do you recognise this story? Emma got pregnant at age 27 and she was very excited, and she went in for her booking in appointment and she left a bit disgruntled, a bit, in fact, crying. And she said the midwife saw her as a checkbox exercise, kind of looking up from her glasses like she's got a rush, she's got to get off. And she booked in her pregnancy, not knowing there was another option, not knowing that she didn't have to do that legally. But this is another problem. You don't know what you don't know. So she goes through her pregnancy and not enjoying it particularly, not the care at least. And then she is told that she has to be induced because she's overdue. Now, I want to backtrack a bit, and I want to ask yourself these questions. What could have happened to Emma if, when the midwife was talking about nutrition and she just said, "Do you eat well?" and checks a box. What if Emma understood nutrition? And what if she understood the correlation between blood volume expansion and eating protein and enough protein? What if she knew that? That might be a really good start. What if she had continuity of care? What if she didn't see a different person every time she went in? What if she felt safe? Do you think that would make a difference to the outcome of her birth? So, moving on. She goes in for an induction. She's told, your likelihood of stillbirth after 41 weeks doubles. That sounds really scary, doesn't it? And I'm not surprised she won't bring it on, because she loves her baby and she wants the best for her baby. But what if at this point Emma asked, double of what? What if she asked that? What are the relative risks versus the absolute risks? And they might have said, well, actually, the risk of stillbirth at 39 weeks is 1 in 730. And at 41 weeks, it's 1 in 926. And at 42, it's 1 in 826. So maybe if they'd asked double of what, that might have been really good. But of course, you don't know what you don't know. How do you know to ask that? We're emotional, we're women, we're agreeable. We're handmaidens. We're taught that. We have ancestral trauma. We have mother wound. And we keep repeating it. But you can stop this. We can cut it. So she says, yeah, I'll go in for the induction. And she is thinking, this must be urgent. So in she goes. No beds for her. They said, I'll come back tomorrow. So she goes back tomorrow. And they start her off with a bit of prostin. Nothing's really working. They can't break her waters because, of course, baby's not ready to be born. So they bring out syntocinon. And syntocinon is a synthetic form of oxytocin. And oxytocin is our natural love hormone. But syntocinon does not work like natural oxytocin. It doesn't reach your brain. It doesn't give you that euphoric, beautiful feeling. What it does do, and not always, I need to make this, I hope you understand watching this, that I don't have to qualify everything. I'm not trying to generalize. I'm saying this does happen. It happens a lot, but not all the time. But what syntocinon can do is just pelt your uterus over and over again with these very strong, unnatural, long contractions, causing hyperstimulation of the uterus. But she wasn't told that. And she wasn't told there were options, like she could leave it. And hey, maybe we can compromise and maybe I can come in regularly for monitoring to see how the baby's doing. That wasn't an option. So instead, she was coerced with very emotive language. Risk of stillbirth double. So she goes in and she's on this drip, and understandably, it's a lot to go through. So she's feeling quite overwhelmed with the sensation, so she asks for an epidural. She doesn't ask what's in the epidural, because why would you? Because everyone knows about epidurals, so why would they give them to you? There's some side effects. She doesn't ask what's in it. Fentanyl is in an epidural. So she's on her back, and she's unable to use gravity on her side to get the baby to come down. So she's laying on her back. This is really good for her practitioners because then she's easily accessible. And which brings me on to my next point, vaginal exams. So different strangers come in and out of the room and put their fingers inside of her. I'm going to examine you now. They didn't say, I want to examine you because of this. Is that okay? But because women have heard other stories and they hear vaginal exams, I think, oh, that's fine. That's normal. But really, if we break it down, it's a stranger, often a stranger, putting their hands inside of you. We don't know, we can say no. Again, don't know what you don't know. But if she had known, she could have said, I don't want one. I've had abuse and it's going to majorly trigger me and I don't feel comfortable. But she assumes it has to happen. But ask yourself, why does it have to happen? Because if the midwife had given her a vaginal exam at 4 p.m. and found she was, 4 or 5 centimetres, that just tells the midwife where she is in that point in time. It doesn't tell her where she's going to be in 5-6 hours or even 10 minutes, because your cervix can dilate pretty quickly or it can take a little while. So she cracks on with the epidural, which tends to slow down the labour, so they up the synto drip, and so it goes on. And what she wasn't told before the induction was hyperstimulation can happen of the uterus and baby can go into distress. So at which point the CTG monitor is telling the midwife that there's a problem. 6 people come in, they take her for a crash C-section. And she walks away thinking her body's failed her. Is this a familiar story? Now, is birth inherently dangerous, or was that a domino effect of intervention? You decide. Because we now, at when push comes to shove, have a control group. And we have a 77% home birth rate. Now, we don't serve thousands, hundreds and thousands of women yet. We don't. I wish we did. I wish more people knew about us. We only serve hundreds. So it's not a direct comparison. But let's have a little experiment. The next 5 women you meet who have given birth recently, ask them, C-section or vaginal birth? And they can ask questions, they can ask questions when they're saying, we've got to induce you. What percentage of your induced babies end up in the NICU? Can you guarantee this won't have any adverse outcome? There are questions that we are allowed to ask. We don't have to say yes to everything. We don't have to carry on this mother wound, this core wound where we are agreeable and say yes to everything. We need to stop this. I'm not saying don't go to hospital and don't listen to them. That's not what I'm saying. It's a shame I have to qualify that. And look, there's already a system that tells everyone what to do, and I don't want any part of that. My thing is empowerment and informed choice. And most importantly, women need to know their own superpower. They don't need to be saved. They don't need anyone at when push comes to shove turning up at their door with a cape on, or a midwife from the NHS turning up at the door with a cape on. They need to locate their own superpower. And they need to remember who they are at their core essence. If you're watching and you're a woman, you know what your gut feeling feels like. You know that if you actually sit with your uncomfortable anxiety and your feelings of dread and fear of authority, or whatever it is, if you can get underneath those feelings, that's where your compass lies. I've never seen a woman's instinct wrong, ever. But I have seen women that weren't listened to. That's why there was a headline today that said, "I was not believed, so I gave birth in a toilet." That is why when I was with one of my very first clients, she started to bleed heavily, and she said, "I know something's wrong." And then she ended up with a crash C-section. So I'm not here to say birth's inherently safe, because it's not. It's not inherently dangerous. I think as humans, we need, we have a yearning for a black and white answer. But we do have answers, and it's within us. And if we can just get out of the noise, just for a little bit, all the fear, we might be able to access that with ease. But the problem is, there are so many women that come... Oh, by the way, I didn't finish Emma's story. Emma called me 18 months later after that birth. She found me on a podcast and she cried and she said, "The story you told was my story." And she went on to have a beautiful HBAC home birth after cesarean. And she caught her own baby against all odds. Everyone telling her, "That's dangerous, you can't do that." Now, here's the thing. Who is to say in another dimension she had that home birth and something went wrong? But this is my point. I'm not trying to argue black and white, black and white. What I'm trying to say is, instead of seeking external knowing, go within. It's a balance. You have to, in this day and age, if you're going to use the maternity system, arm yourself to the teeth with knowledge. Read the NHS Constitution inside and out, because I can guarantee you most midwives haven't. Understand the Human Rights Act 1998. This is all part of the top level stuff, and it's almost superficial. But when we really connect with ourselves, the rest is downstream, comes to you. So what I'm saying is, we have got to address our roots if we want to see better fruits. And we will then be able to advocate for ourselves. I saw a post recently saying you don't need a doula or a midwife, you need a human rights lawyer. Yeah. Yeah, probably. But if you're watching this and you're expecting a baby, or you want to send this to someone, you do have a choice. You do not have to say yes to everything. And a lot of people say, well, they're obviously telling you this for a reason. Go and do some research on maternity guidelines and what percentage is based on evidence. Guidelines is not evidence. Ask for actual evidence and why that applies to you in particular. You're not a number. You're a woman. You're not a statistic. You are an individual, and you matter. And your birth experience matters. And then you get the shame afterwards. This is how postnatal depression can start. You go home with a baby after a traumatic birth and you hear shit like, "Oh, at least you got a healthy baby and that's all that matters." Well, it's fucking not all that matters. It does matter. And I'm not saying what's more important, your arm or your leg. They're both important, right? your birth experience does matter, and you are important, and talk about your birth experience. Own it. Because if you don't talk about it, that's going to be a deep, deep wound. And that will be passed on to the next and the next and the next. Just in my grandmother's generation, you're not allowed to talk about that. You can't talk about birth trauma. You can't even talk about sexual abuse. So we need to start looking at our core wounds if we want to shape the future of birth in an empowered sense for our children and their children. We need to cut this. It's so important to do the work. I did a little video the other day saying birth education alone is not enough. It's not. It's not. I mean, the massive problem we've got is, number one, the birth education seems to be quite secretive in the birth world. Jane Doe, who is pregnant, how do they find this information? Unless you're connected, you know, unless you're already following Kemi, or unless you're following someone who's massive in the birth world, this is not easy information. And then you've got to contend with the fact that you've been hearing the same stories for years. You finally get pregnant. This is the first time you're actually going to learn anything about your body when it comes to birth. And then you've only got a few months. And you're either going to be backed into a corner with fear, or you're going to drop down into trust and make a decision then. Since 2020, there's been a rise in free birth, which is great, but only great for the right reasons. I've had lots of women call me saying, "Do you think I should free birth?" I'm like, if you don't know that answer, what good is my answer? But this is the problem. We've been trained to be handmaidens, to hand over our business, to hand over our birth. We struggle to go inside because we need the constant external, no, you have to do this or you'll be in trouble. Or it's your responsibility, on your head be it. I've heard it from midwives loads of times. Well, on your head be it if your baby dies. Jesus. We have to go within, ladies. And maybe that doesn't mean anything to you. And that's fine too. What I'm saying is, arm yourself with knowledge. Go deep. Remember who you are and take it from there. But don't walk away from your birth experience and think that trauma is normal and that your body failed you, because it didn't. Your care failed you. And this happens with breastfeeding too. I couldn't breastfeed. Well, it sounds to me like a shit support. How can you breastfeed? How can you produce enough milk when society has put this bizarre, strange belief system in your head that you've got to go home from the hospital, transition into mum, partner, businesswoman, friend simultaneously, and you've got to get the housework done, and you've got to invite people over to your house. How the hell can the body do what it's meant to do with all that going on in your head? How can the body do what it's meant to do at birth with all that going on in your head? If you were having sex and making your baby and everything was lovely and dim lights and romantic music and you're releasing oxytocin, as you should, and then some prat opens the door, turns the lights on and says, you can probably reach climax, but maybe not. So I'm just going to keep an eye on you. Would you be surprised if you suddenly couldn't get back into that moment? Birth's the same. It's sacred, and we're observing it and taking notes and going, this isn't working, is it? Of course it's not fucking working. You've got someone staring at you and saying, can I put my hand inside you? And telling you you're not doing it right. In our 1 year birth keeping course, we show a video, and it's a hard watch, but unfortunately it's a pretty common occurrence. This poor woman has her legs in stirrups, and a male doctor is sitting in front of her telling her vagina's not doing what it's meant to be doing, and the baby's too big for her vagina. And he says, I'm going to cut you. She says, we haven't given it a chance, what are you doing? And he said, oh, I'll just go home then. Shall I? You go home and do this by yourself. So gaslighting started straight away, and the shame. And then she's got her mum, who clearly has her own birth trauma and still holding that handmaiden sort of vibe. Listen to the doctor. Do exactly what the doctor tells you. And then he takes a pair of scissors and he cuts her perineum 7 times. And then she got the nurse telling her, shh, crack on. No wonder we are all bitches to each other. Because we've got this consciousness of fear. But we can change it. We can. And again, we've got to go within. But anyway, look, if you want to share this, tag someone who needs to see this. Come to us. This is another option. There are some amazing birth keepers and doulas at When Push Comes to Shove. In fact, one of which I was talking to today. And in 2 years, her C-section rate is big fat 0. Now that can't be right, can it? Because technically 1 in 3 women should need a C-section. And she's done 12 a year. How's that? So I don't think there's actually anything wrong with the pelvis of a woman in 2024. I think there's a lot wrong with this fear consciousness. And I think if women don't know they have a choice, this is going to continue. So I urge you to share this, to tag people. And they need to know there's another way. We don't tell anyone what to do. We just love people. We love them. We support them. We hold space. We facilitate what they want. We support women, not the system. I'm sure you all know there's problems with the system. But as I said earlier, we don't need to criticise, do we? We just need to create, and we need to make a better life for our babies that are coming into the world. We need to cut the generational trauma to fix the mother wound. And we can do it. But first we've got to wake up. And there are so many women out there who are just realising this. They look back at their own birth experience and they're furious. Get furious. Get angry, because it's not acceptable. But when you're done being angry, remember who you are and shine your light. Because I've said it before, and I'll say it again, darkness is not a thing. It's the absence of a thing. You know, there's that brilliant saying about sometimes we think the sky is grey. The sky is never grey. Not ever. It's always blue. Sometimes there's clouds in the way. We've got to get rid of those clouds and just shine our light. Hard to do sometimes. We just need to make sure we're not bogged down in the thinking mind and the monkey mind, as the Buddhists call it. Anyway, I think that's my 2 cents. God, I haven't even looked at any comments. Does anyone have any questions? What have I done? I can't get used to this. Do type away. Didn't even prepare for this. Never do this impromptu live. Anyway, I'll tell you what. We need birth keepers. We need former midwives to come and train with Artemis Academy. It's a birth keeping course. We need as many childbirth companions and advocates or doulas as possible. We need a woman in every village and town who knows this ancient wisdom, who knows there are alternatives to drugs, and who understands functional maternity care rather than the pyramid of big pharma. Big pharma fund the studies dictate the care. I won't go into that because Instagram will put me on the naughty step. But if you want to change the world, one birth at a time, if you are sick of birth sabotage and you think you might be quite good at this, to love and support a woman without telling her what to do and helping her find her superpower, and joining our freaking superb tribe of beautiful women, get in touch. Go to the website, train with us. The calling won't ever go away if you've got it. I think, do you know what this inquiry has shown us today? This is a pendulum, right? And this will break. And when it does break, we'll be ready. But we need as many women as possible. If you're pregnant, train with us. You don't have to want to be a practitioner, but you're going to get an insane amount of birth education, superior birth education. But not only that, our first module is about doing the inner work. Because, and I see this all the time, how in midwifery this is not mandatory, I don't know. Self-development, healing your own trauma. We have got women supporting women who can't regulate their emotions, who react instead of respond, and are in that space of a fear consciousness. But I insist that if you train with me, you have to do the work. You have to do the self-development. It's so important. I'm going to be running some, like a membership area, so coaching. And it doesn't matter what you do, as long as you're a woman, you can come and join. It's a safe space for women to have a community, to have regular coaching, opportunities for retreats, seminars, sort out your business, sort out your wounds, and go out in there and change the world and have this beautiful ripple effect and shine your bloody light. We need to come together. We need unity. And on that note, go to my Substack, The Unity Project. Have a read through a few of my blogs. If you've got a few questions from this live, because there's going to be a lot of gaps, because I'm not going to sit here for 2 days on a live to explain everything, but go on to my Substack. There's a lot of articles there that might be very useful to you or to someone you know. Thank you for listening to me rant this evening. Like I said, this is not usually my style, but I had to say something. I really had to say something. It's important. I hope you all have a phenomenal week. Sending you all love, and see you on. Actually, I'll see you on Wednesday, because I'm doing Wisdom Wednesdays. Anyway, send me a message. Go to whenpushcometoshove.co.uk. Go and shine your light. Bye.